within a patient. Now the law of similars is simply that like cures like. That is, what causes the symptom of an illness can also cure the illness. Now the principle was established many years ago, about 200 years ago, by Hahnemann, who established homeopathy. And he found that, for instance, if he uses mercury, used to be used a lot for syphilis, for the treatment of syphilis. But the problem is that when you treat it, syphilis gets cured, but the patient gets poisoned by the mercury. So in the typical sense, the disease has been cured, but the patient has died. They died of something else, of the toxicity. So he started looking at how do you get around this problem. Because like cures like, when you give mercury to a healthy person, that healthy person will start getting the symptoms of syphilis. If you give a healthy person mercury. Similarly, quinine, which is the normal example used always in homeopathy. Quinine is given to a healthy person, they get all the symptoms of malaria. So the reverse also was considered to be true. And so like cures like. So Hahnemann went about by diluting the substance. The crude substance kept diluting. But of course what he found was when you dilute it, the effect of it is lost. So he came up, after much observation and experimentation, he came up with a method in what we call potentization. And that is where you keep on diluting the crude substance. But while you dilute it, every time you dilute it, you shake it vigorously. And this is the sort of the mystery of homeopathy, the whole potentization, where some other dynamic force in this crude substance is released. You keep diluting, and we dilute it sometimes millions of times. And every time you dilute it is shaken. And so under chemical analysis, there is nothing. But if you give it to a patient, there is a reaction. So our contention is that it deals with the life force. So there is the law of similars, that like cures like. There is the law of potentization, where we keep diluting it and with vigorous shaking, bring out a certain power in that crude substance. And then the third is the law of minimum dose. We follow minimal intervention. Sometimes we joke among ourselves, some homeopaths, to say that what we are actually doing is we are humoring the patient while nature cures the patient. You humor them by giving them something, listening to them, giving them a placebo. Because the body has a huge ability to heal itself, if one knows how to tap it. You don't need extra outside intervention. So there is the law of the minimum dose, and in classical homeopathy there are various different strains of homeopathy which different practitioners use. But in classical homeopathy there are instances where one single dose of one single remedy can cure the most complex of medical problems. Actually, there is one case study which I am sharing with you, which I have first-hand knowledge, which this was done actually. Now, why do we have this law of minimum, of the minimum dose? It is like when you are walking with a child, a small child who is learning to walk, and the child is walking forward, and suddenly you notice that the child is going to fall backwards. You would just put your hand and just sufficient force to hold the child up. If you use too much of force, the child will fall, instead of falling backwards, will fall forwards. This is exactly which happens a lot in this lot of medication that is taken. The body is subjected to so much of toxins that in addition to curing, you also push that body forward into some other trouble, what we of course call side effects. Then there's Hering's law of cure, which we call the cure of the direction of the cure. This is a bit sophisticated but very interesting, and that is when we start curing a patient, the cure starts from the head downwards. So if there was a complaint of the head, the migraine goes first, and then the cure moves down the body. The cure moves from inside outside the body. So if there is a skin eruption, the skin eruption will be the last symptom to vanish. The other pain inside the body will vanish first. Then, of course, from the most important organs to the least important organ, the cure will move that way. And very interestingly, in reverse order of symptoms. So often you will find a patient who has come for a migraine, you've treated the migraine has vanished, and suddenly there is a knee problem. And they say, doctor, we had this knee problem 5 years ago, no, it has come back again. It was okay. So we are reversing the symptoms and taking each thing out of the body one by one. So that is reverse cure. Now the purpose, as I said, of my giving you so much detail is to show that within the body itself and with minimal intervention, one can help the body to heal. Now, cancer in Sri Lanka, Dr. Abdeen will be talking a lot about that, but incidences in cancer in Sri Lanka, like very much following the same pattern worldwide, has been increasing. In 1980, the statistic says that for every 100,000 people, 128 people had cancer in Sri Lanka. By 2000, for every 100,000, this increased to 287. It has probably increased further. So there is an exponential increase in the number of cancer patients in Sri Lanka and worldwide. And the death rate also has increased 100%, death rate as a result of cancer. So something is obviously wrong in the various types of treatments that we are doing. The most common cancers that affect the world in the world over are lung, breast, and the colorectal. In Sri Lanka, of course, it's oral cavity. Worldwide, it is lung, which has the highest number of cancers. In Sri Lanka, it's the oral cavity. And this is followed by breast and the uterine cervix. Now, what is interesting to note is, of course, that worldwide the lung cancers, which is the highest, and in Sri Lanka, which is the oral, the mouth cancers, which are the highest, both are connected to tobacco, the smoking of tobacco or chewing tobacco with betel leaves. These are the highest incidences. And so, of course, naturally, of course, there is the certain natural viruses which also are carcinogens, mainly the human papilloma virus, which causes the uterine cervix cancers. Now, the homeopathic assumption or critique about the traditional allopathic treatment of cancer is based on the fact that in allopathy, cancer is considered to be a very local disease. I think there is a sort of cellular pathology, a model of cellular pathology, which sort of understands that cancer is first a local process, it has got generalized, and then it invades the whole body. This is the normal allopathic understanding of cancer. There's a generalized, very local thing that has happened. Suddenly something happens and it gets generalized and it invades the whole body. But in homeopathy, we do not accept this model of pathology. What we say is that it is a constitutional disease, and the tumor and the cancer is only a manifestation of a bigger disease. And that is why often when a tumor is removed, it re-emerges somewhere else or in the same place in a much more vicious way. There is something more deeper in the body that is causing cancer. So just removing it either surgically or with radiation just is not going to, it can only add to suppression. And when the body is suppressed, it comes out in even more violent form. And often you find death coming much faster. So we consider it as a constitutional disease, and sort of we take this holistic approach as a result.